Hello students, I am Dr. Preeti Tyagi, Assistant Professor of Physiology in VMMC and Safdarjung Hospital, New Delhi. In the last video of surfactant, we discussed the surface tension, the law of Laplace and the surfactant, what is the composition of surfactant and how the surfactant is important to reduce the surface tension to prevent the collapse of alveoli. So this is the second part of surfactant. And this is a very important short note from the respiratory physiology is having 90% chance of the coming in the exam from the respiratory physiology. So this is very important and student you should prepare it properly. Now the important thing is in the lung alveoli wall there are two type of pneumocytes, type 1 pneumocytes and the type 2 pneumocytes. It is formed by the type 2 pneumocytes. Okay. So type 2 pneumocytes are the important cells from which this surfactant is produced. And you know that surfactant is the mixture of phospholipids, proteins and the carbohydrates. Now the functions, this P equal to 2T upon R is the law of Laplace which we have discussed in the previous video. Now the functions of the surfactant is decrease the surface tension. So by decreasing the surface tension, this is decreasing the distending pressure. It means it is helping to keep the alveoli open, or you can say that it prevents the collapse of alveoli, especially during the expiration. During the expiration, the chances of the collapse of alveoli are higher and this surfactant is active more during the expiration, so it prevents the collapse of alveoli during the expiration. Okay. The another function of the surfactant is it prevents the or you can say it keeps the alveoli dry. Whenever there is a chances of the pulmonary edema or whenever there is more hydrostatic pressure, there is a more chances of the alveoli that they cannot remain dry, or you can say there is a chances of pulmonary edema. So it keeps the alveoli, this surfactant is also helpful in keeping the alveoli dry, or you can say that because of this there is a chances of reduction of the pulmonary edema. So it helps in prevention of the pulmonary edema as well. Okay, so these are the important function. So important points till now is the surfactant is produced by type 2 pneumocytes and it is helping in reduction of the you can say it chances of prevention of the alveoli from collapse. It helps to keep the alveoli dry and it helps to prevent the pulmonary edema. Now the factors which can affect the surface tension. There are hormones, the thyroid hormone that is important to, it helps in maturation of the surfactant. Suppose ladies which is having the deficiency of thyroid hormone or the hypothyroid lady, their newborn can have deficiency of the surfactant because this thyroid hormone is very important. Fine. And when this surfactant is produced when the baby is in utero, this is usually, it starts producing from 28 weeks start, but it mature at the 34 weeks of gestation. So the maturation of the surfactant is at the 34 weeks of gestation. If any baby is born before the 34 weeks of gestation, or you can see the premature delivery of the baby, then there are the chances of the reduced surface tension, reduced surfactant in those premature babies. So chances of alveoli collapse is there. Okay. And one important point is that glucocorticoid, or you can say the cortisol hormone, is also important for maturation of the surfactant. The normal delivery is good like if you see in the form of that surfactant maturation during the normal delivery when the baby passes through the birth canal, there is the higher cortisol production is there. This is known as stress hormone. The higher cortisol production is there. So the chances of maturation of the surfactant is more during the normal delivery. But I am not saying that the cesarean delivery is bad as compared to normal, because there are always the risk and the benefits of the normal as well as the cesarean delivery. We will discuss in the other videos. Fine. So the thyroid hormone and the glucocorticoid, they are helpful for maturation of the surfactant. Applied part of this is IRDS, which is infant respiratory distress syndrome. The another name of infant respiratory distress syndrome is hyaline membrane disease. Okay, so IRDS or the hyaline membrane disease are occurring in the premature babies which born before this 34 weeks of gestation. In those, there are chances of collapse of the alveoli, especially during expiration. So those babies, they have respiratory difficulty, respiratory distress occurs in those babies. And also there is patchy atelectasis, that alveoli become collapsed and they become permanently collapsed, they become destroyed also, and that word is known as atelectasis. This is atelectasis. So atelectasis is the symptom of this IRDS which occur in the premature babies which born before the 34 weeks of gestation. So there is atelectasis, there is respiratory distress in those babies, okay, and sometimes they can die even if they born more before the 34 weeks, or you can say the 26 weeks of age. And during the treatment, what we give? We give the cortisol injections, the glucocorticoid injections to the ladies. Usually the obstetrician, they try to give 2 doses 24 apart, the 2 doses of the cortisol like dexamethasone or any other, so that they try to keep the try to make the surfactant as possible as mature. So to prevent the IRDS, we give the ladies 2 doses of glucocorticoids so that it can be prevented. Okay, so this is all about the surfactant. Thank you so much. If you like the videos, subscribe my channel. Thank you.